Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. Happy holidays, and I wanted to talk to you guys today about problems associated with running, so injuries associated with running. So I treat a fair amount of people who have various running injuries. So I wanted to kind of go over some of the common ones with you guys and what you need to think about addressing these problems. So let's start at the foot, and we'll kind of work our way up. So at the foot, some of the things you want to think about are plantar fasciitis, which is essentially an irritation of the plantar fascia, which is the connective tissue that gives support to your arch. So with that repetitive pounding, and in addition to if there's some mechanical issues going on, meaning you have flat feet, you don't have adequate arch support as it is, or high arch, usually more common with flat feet, can result in plantar fasciitis type of problems. Heel pain, again, another one. So related to foot mechanics and just the amount of or the volume of training you're doing and the surface you're training on too. So plantar fasciitis, heel pain, and of course ankle sprains, and those ones are there too. But we're going to talk about some of the more common ones. And going up the chain, shin splints is another big one, and also related to the foot mechanics, structurally how the foot is, as well as strength and flexibility of the lower leg, and even up the chain. Going further up, your knee, which is probably one of the more common ones, having to do with runner's knee pain, which is the common term used for that, which is patellofemoral problems or chondromalacia patella, which is irritation of the tissue between that kneecap, which sits on top of your groove that's created by your thigh bone femur, and that gliding surface getting irritated. And underneath that is your patellar tendon. So patellar tendonitis or tendinosis, or which is degeneration of that tendon. So any of those problems related to that are often very common ones, having to do with the knee. And of course, any of the ligaments around or within that joint can be affected too. So on the inside of the knee, which often people complain about knee pain, can be your meniscus, could be the MCL, which is the medial collateral ligament, either excessive strain on those structures, too much pounding, or just structurally the way the person is built, there's mechanical load going on at that tissue. So those are some of the common ones around the knee. And IT band, of course, which is on the outside of the knee, is that thick connective tissue that sits on the outside of your thigh and goes on the outside of the knee. That's a common one too, with irritation of that tissue. You can have that tissue get really inflamed, painful, sometimes catches, sharp pains. And then heading further up, hip-related issues. So SI joint, sacroiliac joint irritation is one of the ones that I often run into also. And the hip itself, if the hip is too tight, local muscles are too weak, you can have problems locally at the hip too, or further up into the SI joint, which is the sacroiliac joint, or even into the low back sometimes. So along the whole chain, there could be a host of different problems that can take place. So it's important to really keep in mind that if there's an imbalance, or you're weak, or not flexible enough, or there's structurally the way the person is built, that's going to impact not just local tissue, but up the chain too. So you got to really keep in mind when you're looking at various problems that are taking place, that you got to address the whole person, the whole thing. You can't just target, oh, I'm just the person's having foot problems. Yeah, you got to address the foot, but you got to look up the chain too. What's happening? Maybe it's the weakness in the hip, and that's and the core muscles, which is giving them a poor base. So if you're not strong through your base and your center, which is affecting what's happening further down in the chain too, or lack of flexibility or motor control, a lot of those things. So I hope that it gives you an overview of some of the common running injuries. And there are a lot of other injuries out there too. I didn't list all of them, but it gives you an idea of the various problems that can be taking place. and that you can very effectively address these problems. And I do it all the time in my clinic with a lot of my patients. And you can continue to run, but you really need to make sure you address those problems so they don't become nagging issues and chronic problems where they start causing serious degenerative or other changes to the joint or other local tissues. So I hope you found that helpful, and make sure to leave a comment if you have a question. Subscribe to the channel. Make sure you click on the link below to check out my site. There's lots of info there. And happy holidays. Thanks.